Hi everyone, thank you for joining us today at our August Lunch and Learn. During National Immunization Awareness Month, we have Rebekah White, LPN, presenting on the importance of immunizations. She is the vaccine coordinator here at Good Shepherd.
Thank you for having me, and hello everyone. Today I'm going to present to you just an overview of some of the common vaccines that adults are in need of, and let you know the importance of being updated on your vaccines too. I know it's not a popular topic, but I want to make sure that I'm giving you the information that will help you most. So I'm going to use what the Advisory Committee on Immunization Practices recommends. So let's get started. One of the common misconceptions is that only children need vaccinations. Yes, they do need quite a few vaccinations. We try to get them started out right early with the protection they need. But also adults will need some vaccines that are specific to adults or are boosters of vaccines they probably received as a child and are getting less effective. In the U.S., vaccines have greatly reduced or eliminated many infectious diseases, but there are some viruses and bacteria that do still remain, so we do need that protection to make sure that we're safe. And some of the vaccines that adults need, always check with your medical provider, but the vaccines that most adults need, whoops, okay, sorry about that, is Tdap, which most people know of as tetanus. It does have diphtheria, and pertussis also, which pertussis is whooping cough. And you actually need that every 10 years. Seasonal flu is another one that we get every year. Shingrix is a shingles vaccine that's just a 2-dose series and you're done. Hepatitis vaccines may be needed also, the hepatitis A or B or both, and then HPV. And these are what you will want to check with your provider and see where you are and if you need any of those. So why vaccines are important? You can't afford to get sick. You have a busy life and too much responsibility to risk getting sick. Vaccines can help you stay healthy. You don't miss work. If you can avoid getting sick, you will have more time for family, friends, and hobbies. Getting recommended vaccines can give you some peace of mind. You will have the best possible protection available against a number of serious diseases. For medical care, it can be expensive if vaccines aren't gotten, and insurances pay for most of the vaccines, usually all of them. ACIP that I just mentioned is what the insurances go by. If they are recommended by ACIP, they will cover them. And for people who may be retired or have comorbidities, immunizations are very valuable to keep them healthy. I like this little cartoon about the smallpox vaccine. It did help because we don't have smallpox anymore. And it's a long history behind it, something that is worth getting into and reading about so that you know more about it. It goes back as far as the 1700s. Another wonderful thing, valuable thing to us about getting our vaccines and making sure we're up to date is that we can protect ourselves as well as our loved ones from disease. So vaccines lower your chance of getting certain diseases and your chance of giving anything to someone else. And here again is a little more detail about the Hepatitis B vaccine, which lowers your risk of liver cancer. HPV vaccine lowers your risk of cervical cancers. And flu vaccine lowers your risk of flu-related heart attacks and other flu-related complications, including existing health conditions like diabetes and chronic lung disease. So one of the most common vaccine preventable diseases is influenza, and yet it seems that we often will get every vaccine but that one, and that one is so valuable. I have had the flu once in my adult life, middle age probably, and it took me over a month to fully recuperate. So as a healthcare worker, when I'm in contact with patients who are positive for flu frequently, I really do not want to ever have the flu again, and I have put my flu shot to test numerous times. Something that's rather interesting, here's an example for you. Tdap is important to update for adults because a lot of times adults will think about their children or their grandchildren needing an update, but they don't understand that they need one too, and that they can frequently have something, whooping cough, they can get without even knowing they have it. A lot of times they'll have a very mild case, but it can be very serious for children that aren't vaccinated. And the flu shot is kind of the opposite, where if the children get the flu shot, they won't contract influenza through their daycare and school contact, and they won't be spreading it to grandparents, which they can oftentimes have more serious side effects from the flu. And here again is where I got that influenza kills more people than all of the other vaccine preventable diseases combined. And vaccines are covered by your insurance. And if you don't have insurance or your insurance doesn't cover certain vaccines, there you do have some options. There's Vaccines for Children program that we have here in Good Shepherd Medical Group in 3 of our clinics. Pediatrics, primary care, and urgent care have these vaccine stocks that the Oregon State provide for free to those who are eligible. And also the COVID vaccine is still free. And our county health department has a lot of resources. You can make an appointment with them to get your vaccines up to date or with your provider. Another vaccine that is really important to people that are 50 years old or older is the Shingles Vaccine. This will protect you from shingles, which when it flares up, it can cover large parts of your body and be very painful, and you can transmit the infection to others through open blisters. So if you have not been vaccinated for chickenpox or have ever had even a mild case of chickenpox, you are at risk for shingles later in adult life. And this is only the 2 series and done vaccine. HPV is another one that you can get from the time children are 9 years old up through adults now can get that vaccine to prevent cancer. And COVID-19, one of the concerns with that is that 98% of those falling ill and being hospitalized right now with this virus have not been vaccinated or are partially vaccinated. Umatilla County is seeing some of the highest infections per capita of all Oregon counties. So please do yourself a favor and get that vaccine and protect yourself and your loved ones. Contact your primary care or your county health, and they can help you update. Vaccines have been extensively studied and proved safe and effective. And we even have a vaccine adverse event reporting system for the few incidences we have of adverse events so that they can follow that. And vaccine schedules have been carefully studied and set for our protection. So it's best to follow these vaccine schedules and space your vaccines the way they recommend. They have the best effectiveness for you that way. Healthcare providers also need to be protected. Your community is counting on you to protect them. And I guess the only thing I would like to ask you is, when will you choose to get your vaccinations up to date so you can protect your loved ones and yourself? With children going back to school and adults going back to the workplace, it is now more important than ever for everyone to get back on track with routine vaccinations. A lot of the normal vaccines that we got before, because of well checks with our provider, got delayed during that pandemic. So make sure that you're up to date with all your vaccine. And keep yourself and your family, friends, and community healthy.